This is different. Our new mantra, unfortunately, is Delta is different. It's also more deadly.
It's a long, slow, and frankly awful disease to watch. People have low oxygen levels for days or weeks. We have people dying here almost every day. I'm 42, and this is patients that look like me, that are in my age group. These are young people that aren't unhealthy, and they're dying of this. A nurse and I had to hold the hand of a patient that we took off a breathing machine, off a ventilator, while his family was on FaceTime, and he had a bunch of kids that are the same age as my kids watching this, saying, "I love you, Daddy." And this is a guy that's same age as me, and like, this is profoundly awful to watch people go through this.
Long haul COVID, which some folks may or may not be familiar with, is really starting to cause what in the medical community we refer to as the morbidity. So we touched on the mortality, and it is real, and patients are dying of COVID and dying at a younger age with the Delta variant. But the morbidity, how sick am I, and what do I look like when I recover or whenever I finally recover, that certainly is causing another larger impact.
We are seeing children, young infants through teenagers who are not only testing positive, but having symptoms and having illness that's requiring care. This is different from before. In the past, that we didn't see kids get quite as sick or need hospitalization in the same way, and we're seeing more of that now. We're also just seeing more kids test positive.
There are pregnant patients with COVID in our community. If you have COVID and you are pregnant, you are 15 times more likely to die. You are 14 times more likely needed to be intubated. You are 22 more times likely to have a preterm delivery. This disease, the Delta variant, is impacting our pregnant patients.
This is what we were all worried about, and now we are experiencing it, and it's not an experience that any of us have wanted to have for any of us or any of our family members or loved ones.
We're tired, and that in all honesty, we're sad. The things that are happening in our hospital and in our community are really difficult. They're difficult at work, they're difficult at home. It's personal, it's professional, and it hits everyone. Our nurses are working hard every day, as well as our doctors, our environmental service workers, respiratory therapists, pharmacists, every single position that we have in our organization to make sure we can continue our due diligence and help keep our community safe and healthy. And frankly, we need your help.
I grew up in Fairbanks, and I know that if somebody was broken down on the side of the road at 40 below, anybody would pull over to help them. And this is the same thing, right? So we have to get vaccinated, we have to wear our masks, because this is what we need to do for our community. This is what we're obligated to do to help people, even if that's inconvenient to us.